It may surprise you to hear that it is normal for your baby to cry and strain and look uncomfortable every time they're trying to poop. Every baby is different, but newborns have a lot of weird behaviors that we actually consider normal, but can be stressful. I'm Dr. Nkirike, pediatric hero doctor, and today I'm going to be talking about 5 things that newborns do that actually have parents concerned and end up in emergency room, but they are actually normal. Number 1 is the hands and the feet looking blue, and we call this acrocyanosis. This is obviously more common in kids who are light skinned, because then you can notice it looking blue. In kids who are darker skinned, it may look darker, but just may not be obvious to you at that point. When acrocyanosis happens, only the baby's hands or maybe up to the arms and the feet appear blue, and the rest of the baby's body still maintains their natural color. This happens because the baby's circulation system is still not fully mature, so they cannot figure out how to circulate the system completely. So they focus on circulating to the important organs like the brain, the heart, and the lungs, rather than the hands and the feet. It is most common immediately after your baby is born or within the first 2 days, but it may still persist up until 2 weeks when their body is still developing. Also, it may occur when you expose your baby or take off the clothes. You notice that the hands and feet become blue, and once you cover them up, the skin color becomes back to normal again. Acrocyanosis resolves on its own as your baby's food system continues to mature and develop, and as your baby grows. If you ever notice your baby's face turning blue or the rest of the baby's body turning blue, or maybe the hands and the feet are blue and your baby looks uncomfortable and having breathing difficulties, you should definitely get them evaluated. Number 2 is a common reason we always see patients in the ED, and that is straining to poop or looking uncomfortable and crying every time they poop. Do you know that babies rarely get constipated, but every time they want to poop, they look so uncomfortable and cry? This is what we call infant dyschezia. Baby poop can go through different phases. The first poop is the meconium, which is usually black or darker green, and a lot of babies pass it at birth, but some others may pass it within first 24 to 36 hours after birth, and this is normal. Then they transition into the greenish or the yellowish poop, which is usually mushy. The straining and discomfort that babies have happens because their body has not figured out the coordination that happens to have a bowel movement. They're not quite sure which muscles to contract and what muscles to relax for them to be able to pass stool. For successful pooping, the muscles around the pelvic area, which is around the butt, has to relax, and the muscles around the belly, which is the abdomen, has to increase and put a lot of pressure for us to successfully poop. Babies have not figured that out. First of all, they're laying on their back and they're not standing against gravity to be able to help them contract the belly. So they cry and strain because they're trying to increase those belly muscles to be able to contract and pass a bowel movement. Eventually, by doing that in a couple of minutes, the pelvic muscles also relax, and then they're successfully able to poop. Straining to poop in babies can happen for about 10 minutes before they're eventually able to successfully poop. As long as their poop is not hard, not in pebbles, and does not have blood, it is totally okay to let them be, and it's going to resolve as they grow. Some babies might do this up until 6 months of age. Some might stop earlier. It just depends on the baby, and they're eventually able to figure that out. Belly massages, keeping them in a slightly seated position when they're about to poop, might usually help them get that out easily, but sometimes it may not necessarily help. Number 3 is penile erection. We have no idea why this happens, but it is actually very common. It happens when they are still in the womb as babies, and that might be one of the things they see during ultrasound to be able to tell the sex of your baby before they are born. We usually chalk it up to biology and normal function of babies, which is great. It might also be a sign they're about to pee. So every time you take off a diaper and your child's penis aims at you, they might just be about to pee and might actually pee on you. This has nothing to do with sexual arousal as an adult, but if your child has persistent penile erection and it looks uncomfortable every time you touch their penis, you should definitely get that evaluated because it is not normal for newborns or babies to have persistent penile erection. Number 4 is another common we usually see patients and concerned parent families in the ER, and that's the sensation that the soft spot, which is here, is beating or pounding. The soft spot is medically known as anterior fontanelle. It's actually the space that is open around the skull that allows your baby's head to mold as they are being delivered through your birth canal. It is also the space that allows for your baby's brain to continue to grow and develop as they get older and bigger. And usually the soft spot can close between 10 months and 18 months, or in some cases might close about 2 years of age. Your baby's anterior fontanelle, which is a soft spot, may actually beat and pulsate with the heartbeat. And that's because with every cardiac activity, it sends blood vessels to the rest of the body and also to the brain. So you may feel your child's soft spot pounding, but this should not be excessive. This should not be beating more than the heart, or your child should not look uncomfortable when this is happening. You might also feel this area bulge and look bigger every time your child cries or strains to poop, but it's supposed to go back to its normal flat size after that, and if it's not, you definitely want to get that evaluated. If you ever notice your child's soft spot bulging out more or looking more protruding, especially when they are not crying or being uncomfortable, we usually get concerned about fluid accumulation around the brain or even a brain infection. We want that evaluated. On the other hand, if you notice your child's soft spot looks like it's sunken in and depressed, especially when your baby has not been wanting to feed for a while, we also get concerned about dehydration and want them to get evaluated as soon as possible. So as much as a pulsating soft spot is normal, a protruding one when your child is not uncomfortable or one that's sunken in should always get evaluated. Number 5 is when your newborn passes orange or brick orange tinge in their urine. This is half normal and actually half concerning. Babies are born with a high uric acid content, which they usually acquire through the placenta before they are born. And during the first few days of life, before feeding is completely established, you may notice them passing urate crystals, which appear as brick orange or orange in their diaper. It is slightly more common in breastfed babies when the colostrum and milk letdown is yet to be established and breastfeeding is yet to be established for the baby. As much as the baby is trying to get rid of the uric acid as crystals in their urine, if you're noticing a lot more of it or looking darker, it may also be a sign that your baby is dehydrated or not getting enough feeds from either parent or formula they are being fed. It typically lasts about 3 days, and one of the main things you can do is to continue to encourage feeds. If you're a breastfeeding parent, you can actually express to give you an idea of how much feeds you're making to make sure your baby is receiving enough feed to be able to get them hydrated and reduce the amount of obvious urate crystals you are seeing. You should definitely talk with your pediatrician if you're seeing large amounts of orange-colored pee to see if they need supplementation with either formula or IV fluids. On the other hand, if your baby is having discolored urine which is orange and also refusing to feed or excessively sleeping, then you should definitely take them to the emergency room or have your pediatrician evaluate them to make sure there's nothing else that needs to be done for them and make sure they're adequately hydrated. In a previous video, I talked about 5 things that babies do that are not normal, and I want you to go watch that here. But these are a few other things that are scary that babies do that are completely normal. My baby also had a first period when she was born, which you call the falsemenses. And I'm curious to know if your baby had any of these weird things or any other things that I didn't mention in this video. Leave me a comment in the comment section and let me know all about it. Again, thanks for being here, and I will see you in the next video.